You're listening to IOE Insights, the UCL Institute of Education podcast at University College London.
This is Research for the Real World, conversations about education and social science research and its impact on policy, practice, and our everyday lives.
This is Research for the Real World. Hello, I'm Mark Quinn, and I'm an Associate Professor and Deputy Programme Director for the Early Career Teacher Entitlement Programmes here at the IOE. In this season of Research for the Real World, we're highlighting the UCL Centre for Longitudinal Studies and its role in developing powerful resources and evidence for research and policy development, and to inform and shape the world we live in today. So today, I'm really excited to have Dr. Gergo Baranyi. Gergo is a Senior Research Fellow at the Social Research Institute, and his research focuses on the lifecourse impact of physical and social environments on cognitive and mental health and on healthy aging. Have I got that right?
Yes, exactly. Thank you very much for the introduction. I'm also very happy to be here.
It's great to have you. So before joining UCL, Gergo was a research associate at the University of Edinburgh, where he worked on projects exploring how air pollution and air level deprivation across the life course associated with longevity, as well as cognitive, biological, and brain aging. He completed his PhD, well done, on area level crime and mental health in Edinburgh. And Gergo has a wide range of international collaborations in cities such as Berlin, Barcelona, and Budapest. All the Bs, I notice. We're particularly interested today in how Gergo's research explores the administrative and geospatial data linked to cohort study data. So, welcome again, Gergo, to the podcast.
Thank you.
So just to get us started, we'd really just like to know, first of all, about your journey through your career, how you came to study what you're studying right now, and what got you interested in this area of study.
Yeah, so I started my studies back in Budapest. So I studied psychology. And from that time point, I was very interested to understand why some people develop mental health problems, why other people don't. So I studied psychology, and later on I realized that in addition to individual factors, there might be also societal factors which might be important, such as individuals living in particular areas are more likely to have mental health problems than others. And this led actually me to study public health. I did my second degree in public health in Berlin, and later doing a PhD in geography. So literally from the interest on mental health and the distribution of mental health problems, I was starting to kind of understand how the social factors also play a role in the etiology of mental health problems, and also like the environmental factors. And then during my PhD in Edinburgh, I became very interested in the environmental determinants of mental health, and especially using longitudinal and cohort studies, which are basically studies where we measure the same thing multiple times.
And why in particular have you chosen to research housing quality and the connection and the associations between that and outcomes in school for children?
Yeah, so this is my very most recent paper. So yes, I'm generally interested in environment. And environment, when I'm talking about environment, this is everything which is, on one hand, outside of our home, but also inside of our home. So this is the physical kind of like characteristic of places where we live, but also somehow the social characteristics. So who we are living with, how is our neighbourhood, and so on. So I had this interest literally since the beginning of my PhD. And in the last few years, I was mainly focusing on the environment which is outside of our home, so the neighbourhood. And most recently, I started to focus also on housing conditions. And one of the reasons I focus on housing conditions and educational outcomes is because there is very little research on it. So obviously, there is some research on linking overcrowding, for example, to educational attainment, so how good, for example, the grades of kids are, but very little research on linking this to other educational outcomes, such as, for example, missing school absence. Mm-hmm. And this really struck my interest to trying to understand whether we can also link other housing conditions, such as, for example, dump, living in particular type of flats, having access to a garden, whether we can link also these other physical characteristics of the homes we are living to educational outcomes, and not just grades in schools, but also to missing school in general.
So thinking about those different housing conditions, what have you found so far to be the strongest associations between those conditions and outcomes for children?
Yeah, so what we did, we used 6 different indicators of housing quality. And out of the 6, the most important ones looked like was damp and mold in the homes and overcrowding. I have to say that these were all measured by asking the parents whether there was any damp and mold in the home, and they had to indicate that yes or not, and if yes, whether it is a small problem or a great problem. So it is all self-reported measure by the parents. And yes, I would really say that overcrowding and damp were the 2 main characteristics which were associated with educational outcomes. We also find some associations with having a central heating or not, and whether somebody lives in a flat or a house, but it was really like damp and overcrowding, the 2 main characteristics.
And how significant are those associations or the impacts that you think you found?
They were actually surprisingly large associations. So first we created a scale using these 6 different indicators of housing quality. And we said that those individuals who reported to have negative housing conditions in at least 2 dimensions, they were considered as having lower quality housing as opposed to having a higher quality housing. And among those, they were living in a lower quality housing. We find that kids missed on average more than 15 days of school across compulsory education. So compulsory education is 11 years. So I would say this is quite substantial, especially if we compare how many days they usually miss on average.
I see. So it's 15 days is about 3 weeks of schooling, but it's 3 weeks on top of the other missing days they might have, right?
Yes. So we also take into consideration socioeconomic status, the parents' educational level, and so on. So this is really in addition to all of these factors.
So these are additional factors affecting the absence of the child from school. And what age is the child when you're measuring this?
So we had information on missingness throughout the whole compulsory education, and housing qualities were measured at age 7. So around the beginning of compulsory education.
Okay, and you were using the Millennium Cohort Study for this and the National Pupil Database for this as well?
Exactly.
Do you want to say something about how, the value of those 2 databases and how you were able to use both of them together?
So I'm based at the Center of Longitudinal Studies, and we are hosting series of amazing nationally representative cohort studies. And one of them is the Millennium Cohort Study. So basically, this is a study of approximately 20,000 children. They were born around 2000, 2002, and they have been followed up ever since regularly. So the first data collection wave took place when I think they were 9 months old, and then the next one at age 3, 5, 7, 11, 14, 17. So it's very regular. And there's a large amount of information collected from these kids. We also know, for example, the addresses where they are living, so we're able to link it to environmental information. And in addition to that, certain time parents were asked whether they would agree or whether they would consent that administrative information can be linked to the cohort. So I think at age 7, the parents were asked whether they agree to link the kids' educational records to the study. And the educational records in this case are the National Pupil Database, which is collected by the Department of Education.
Yeah, and that's another huge database which you spend a lot of time looking at.
Yes, absolutely. And really what makes this study really great that we were able to do the linkage between survey data and administrative data, which is not often the case.
So housing is a factor in pupil outcomes and pupil attendance and pupil outcomes, which I think you're able to demonstrate in the research. But I guess there's an argument that it may be, is it a causal factor, do you think, or do you think it's an associative factor? How strong do you think is that linkage, or are you able to say?
So I would like to say, first of all, that this is observational data, what we used here, not an experimental data, which means that it's really hard to draw any causal inference based off our data. So therefore, I would really just describe kind of associations and correlations here.
And there are other socioeconomic disadvantage factors which you would also see present.
Yes, absolutely. So basically what we do in this kind of research, we control for a lot of socioeconomic factors. And actually we saw that after we control for income, education attainment of the parents, the association between housing conditions and educational attainment or absence reduces. So we see that actually socioeconomic status of the parents explains some of these variation. But still after this, we find some significant associations, which were, as we discussed, quite substantial.
So, Gergo, you've been telling us about different environmental factors and the relative associations between those and impacts you've seen. Can you draw a connection for us between those different factors and what you see in the Millennium Cohort Study data itself?
As I mentioned, we found that built and social environment was associated with mental health of children. And basically what we did in terms of data, we linked the home addresses of these kids together with environmental data across 20 years of time. And in terms of linkage, we use two different methods. First, we know for each address in what geographic area it is. So there are different geographies in the UK, and based on those geographies, we are able to link external data to the cohorts. So for example, there is the index of multiple deprivation in each of the countries of the UK. And these indices, they provide information on small geographic areas, such as LSOAs, lower output areas. Mm-hmm. And what we did, we basically linked these information together to the cohort. So this is one way how we did the linkage. The other way was we have the coordinates for these addresses, which is like an x and y coordinate. So you can locate place on the Earth's surface using these coordinates. And so we have the coordinates on one hand. On the other hand, we have layers of maps, and we are able to link these together. So for example, for air pollution, we had air pollution maps. They are covering the whole of the UK. And we were linking together these maps to the cohort members' location. And because usually people are not just like sitting in their homes all day.
They move. They live with one place and maybe go to school in another, or they move house, of course.
Yes, absolutely. And this is one of the complications when we are using this geographic type of data. So what we can do, and what we also try to do in these studies, we were drawing buffers around the residential homes. So for example, you can draw a 300-meter buffer, which is approximately 5-minute walk, or you can draw a larger buffer, 500-meter or 1,000-meter buffer. And we computed the average exposure within those buffers.
Okay.
And then these buffers were then linked to the cohort.
And is the assumption within that buffer that's where the young person will be living and playing and going to school?
This is exactly the assumption. And at the same time, we know this is not 100% true, because very likely people are going outside of their buffers, or people are just going, on the particular directions all the time and not in the other direction from their homes.
Particularly the more socially advantaged they are.
Yeah, so there are also individual differences. Mm-hmm. So we know that the mobility of individuals differs very much based on age, whether they are male or female, or what kind of jobs they have. So we know that this all differs. So we still kind of have to capture the potential area of exposure. And what we do is usually using buffers, which we know are not the best way to do it. But it's really hard to put a GPS on every participant in a cohort to derive the exact exposure. And also not very ethical.
And I guess if you're talking about environment itself changes in the geography, perhaps not largely, or maybe not fast, I'm not sure. But if you're talking about pollution levels are not the same throughout the 17-year period of this particular cohort.
Yes, absolutely. So that's why it was important for us to have annual or on every 5 years these environmental exposures measured. So for example, for air pollution, we had air pollution maps for every year, and we were linking these air pollution maps using buffers to the addresses where these kids were living. For green space, for example, we know that green space is not changing that fast. For that, we had green space measures in every few years. So yes, depending on how fast this environmental characteristics might change, we might need different repeatedly measured environmental data. So for air pollution, more frequent ones are needed.
Yeah, and we talked at the beginning about administrative and survey data. Can you just explain to our listeners what the differences between these two types are?
Yes, absolutely. So survey data is when researchers or agencies which are working for researchers go to people and ask particular questions from them. This is survey data here. The participants actively decide that, okay, I want to participate in this data collection. And then if it's a longitudinal data collection, then they are asked in every few years' time whether they want to still be part of this data collection, and they provide data in every few years. And at one point, they can say that, well, I'm not interested anymore to be in this cohort, or they can, leave the area and move somewhere else, and the cohort managers are not able to reach them anymore. So this is kind of like one of the limitations of survey data, that people might be not traceable after a certain amount of time. On the other side, administrative data, is basically data which is routinely collected in different government organizations or by private companies. So, for example, the administrative data, what we used in the study on housing conditions and educational outcomes, comes from Department for Education. And this data is based on all state-maintained schools, and these schools have to report every certain intervals how many of their children are missing school, and they also have to report information on the children's attainment or exam scores. And this administrative data is therefore much more complete than a survey data. It is also not based on whether people consent to be part of it or not, but it is based on what data the government is able to collect.
According to the unique pupil number that each child has.
Unique pupil numbers, exactly. Similarly, it works, for example, with NHS data as well. So we have hospital episode statistics, which can be linked to cohorts. And again, if somebody comes into interaction with NHS or with any other healthcare providers, which are covered by NHS, then this information will be available by NHS Digital, and we will be able to link this to the cohort. So as you see, this administrative data has an almost universal coverage. However, there are also some biases in this data, such as, for example, kids, they are not going to state-maintained schools, for example, going to private schools, or they are homeschooled, they are not captured in this data set. So this is a certain limitation, what we have to consider when we are using this type of information. It's very similar with hospital episode statistics, so with health data. If individuals don't go to NHS hospitals or to private hospitals, this will be not captured there. However, still, this information still provides us much wider and almost universal coverage. So when we link together survey data with administrative data, we are able to capitalize on the advantages of both of these type of data. Because for survey data, we have a huge amount of information what we collect from the survey participants. We ask them about their opinion about particular topics. We ask them how they feel on a certain day. We ask them about their socioeconomic status, about their childhood, and so on. So there's a real wealth of information here on one hand. On the other hand, we have this administrative data, which provides an almost universal coverage in certain areas. However, the data there is not that detailed. So, for example, we don't have information on their parents' socioeconomic status. We don't necessarily have information on their mental health based on symptom scales or something like that. So when we combine these two different types of information, we can try to get the best from both of these different worlds.
I think in your research you mentioned that in England, in any case in England, about 1 in 7 households are living in accommodation which is below a basic quality. Do you find that children are more likely to be living in poor quality housing, or less likely to be living in poor quality housing? Are children particularly affected by poor quality housing?
Yes, so you refer to the decent housing standards, which is set by the government. And what we also assume that, yes, children are more likely to live in homes which are below on this decent housing standard. One of the factors which is measured often there is overcrowding, and obviously when there are children at home, they are more likely overcrowded those homes than in comparative when they don't have children.
There are just simply more children in the home
than
there are. But I suppose this also means that your research has urgency and resonance for public policy, right? Because if children are more likely to be suffering for the effects of poor housing, something should be done about it.
Yes, absolutely. And I would say that our research came in a very great time point, because just in October this year, so like a few weeks ago, there was a new policy introduced, the AWAPS law, which basically forced social landlords to investigate and fix any hazardous housing related issues within a certain time frame. It was really kind of like draw up to fix any damp and mold related issues. So you might recall it a few years ago, there was this case when a 2-year-old boy of UP died because of serious mold issues. So I think it's really kind of like resonates, this research, with this new policy change.
So thank you for that, Gergo. I might just pivot now back to another area that you've been looking at, a related area, obviously, which is associations between environmental exposures and mental health in adolescence. So just in a nutshell, can you summarize what you've been finding with that piece of research?
Yes, so we used actually the exact same data set, so the Millennium Cohort study, and we were very much interested to try to have longitudinal information on environmental data. And I'm saying environmental data, here we focused, for example, on built environments, such as access to green space, blue space, whether the area is built up or not built up, how walkable the area is, and so on. We also focused on the social environment, which includes area deprivation, crime, and also on the chemical physical environment, which includes air pollution mainly. And what really this study was trying to do, we were trying to identify specific ages during this kids' early life course where the impact of these environmental exposures might have a long-lasting effect on mental health. And for this, we really needed 20 years of longitudinal data on exposure, so on these different environmental factors. And our outcome mental health was measured at age 17. And we measured mental health outcome in two different ways. Once children were asked whether they have ever been diagnosed with a serious anxiety or depression, and we also use a symptom scale to assess whether they have any common mental disorders.
Mm-hmm. And did you find a particularly strong association between one environmental factor and mental health in adolescence at 17?
Yes,
or
absolutely.
A combination of those factors?
Yes, absolutely. So basically what we find that social and built environment in childhood and adolescence is associated with mental health problems. And I think it's important to stress that social and built environment together. As I mentioned, we use a lot of different environmental exposures. The reason for that is that we know that environmental exposures are highly correlated with each other. So for example, in areas where there is more green space, there will be very likely less built up or concrete. Similarly, in areas where there is high green space, there is more likely less air pollution. Or when there is high air pollution, there might be also higher noise. So somehow these environmental exposures, they are strongly associated because they have a common source. For example, for air pollution and noise, we know that the common source is traffic very often, or because they are all relating to social or structural disadvantage in the area. In more deprived areas, there is likely higher noise, higher air pollution, and lower quality green spaces. So therefore, it was important for us to also try to understand how they, in combination, might affect mental health, not just focusing on one particular exposure, because it's also very hard using observational data to separate the impact of all of these exposures.
And is there more research in this area that you'll be conducting within the centre, or that you are inviting others to conduct in the same field?
Yes, absolutely. So we have a few more studies ongoing at the moment. One of them is specifically focusing on neurodevelopmental outcomes, such as autism and ADHD. We are trying to understand whether we can identify any environmental factors, again, from birth up until adolescence, which might be related to ADHD or autism. This is one of the studies we are working on. And also recently we finished another study on air pollution and general health among children, where we specifically were trying to understand whether there are any sensitive periods during the first 17 years where exposure to air pollution might have a stronger effect on health of these children.
And have you found?
Interesting, we find actually that air pollution exposure between age 3 and 6 had a stronger effect on general health than air pollution outside of this sensitive window, which might be related to the fact that several organ systems are developing during this time. So there are morphological and functional changes undergoing in children. And if they are exposed to toxic air pollution levels during that time, that might have a stronger and long-lasting impact on their health and well-being.
And obviously, this is a huge study, the Millennium Cohort study, and these children live all over England and Scotland and Wales, and they live in the urban areas and they live in rural areas. Are you finding a difference between the nations of Britain, and are you finding a difference, an urban-rural distinction in your data?
I think this is a very important point of what you just mentioned, that our study covers the whole of the UK on one hand, and on the other hand, it covers also urban and rural areas. Because very often in research on environment and health, they are focusing on urban samples.
Right.
And we know that environmental exposures in urban areas are very different than in rural areas. So that's why using the cohort study and other nationally representative studies is crucially important if we want to understand the relationship between environment and health, and how different environments and how different areas can modify the impact of environmental exposures on health. So we didn't do any studies specifically exploring the difference between England, Scotland, Wales, and so on. However, in one of our studies, we focused on trying to understand whether the impact of specific environmental exposures differ in urban versus in rural areas. And it was very interesting to see that it does. So living, for example, in rural areas where the built environment is very low quality, where, for example, there are no access to green space, or in rural areas which have particularly high crime, for example, air deprivation, had a stronger impact on mental health than the same level of deprivation or same level of green space in urban areas.
So just let me ask that again. So that's, to me, counterintuitive. You said in the rural areas, the access to green spaces might be lower. Did I hear you correctly?
No, that's very important here. I'm not saying that the exposure is different. I'm just saying that if you are keeping the exposure at the same level, overall, then the effect is basically larger.
Right.
We know that in rural areas, percentage of green space coverage is much higher than in urban areas. So we know it very clearly. It is really that the association differs.
Yes.
Which is very interesting. So we know that also urban areas are less deprived. There's less crime there in rural areas. Also, they have more green space. Still, in those specific rural areas which have less green space or they are more deprived, the association with mental health problems were much stronger.
Yes. And so although crime might be lower in some rural areas, where it exists or where the individual is exposed to it, it may have a larger effect on them. Okay. And of course, that suggests that there's a huge policy implication, social policy implication for this kind of study, right? So if we know more about the differential effects of the built environment and the environment generally, and there are differences rurally and in urban areas, that has implications for how government works and how funding happens. And are you allowed to send any messages out to policymakers in this, or which policymakers do you feel should be reading your research, Gergo?
So I think the government recently put quite a lot of emphasis on coastal communities, for example, which are not necessarily like large cities there, but general coastal communities. And while we know that living close to blue space from a lot of international research is good for health and mental health, especially here in England, is not necessarily the case. We are seeing that in coastal communities, the mental health of young people is actually much worse than in non-coastal communities with the same deprivation. And the government has already realized that there is this difference. So I think it's very important to try to understand why is this the case. So why is deprivation in a coastal community or generally deprivation in a more rural community more damaging for health and well-being than in a comparable inland or in a comparable urban community? So I think on one hand, we have still a lot of work needed to understand why is there this difference. Potentially, as the government is also doing, we need more support for these communities to tackle, for example, young adults' mental health problems and so on. We also know that in coastal communities, the incidence of suicide is much higher, for example, than in communities. So we see that there are certain health problems and they need to be tackled and understood why is this really the case.
So some listeners to the podcast, they are in schools, they're running schools or teaching in schools, or they're working in local authorities or for housing associations. There are people who are maybe not making policy, but they are enacting policy across the country in those rural areas and in those urban areas. And is there anything practical that they could be doing differently, either to address, because we've talked about mental health as well as learning outcomes and absence in schools, for example. Is there anything that you feel that people working in those areas could do to make a difference for those adolescents and young people?
So I would just go back to the study about housing conditions and school absence. So as I mentioned, there is this VAB law which just came into force a few weeks ago. I think enforcing it, that would be very important. And as I understood, this law is first applicable for social landlords, so potentially extending it to private landlords would be very important, given that there is already a wealth of evidence suggesting a link between damp and mold and children's health. And our study also shows that there is an association with educational outcomes. So I think it would be very important that the law is in place to enforce it appropriately from the council. And also, for example, if parents, they see that there is an issue with mold and damp in their homes, that they should actually report it to if it's a social housing, they should report it to their social landlord, or they try to fix it in a way or another, because it has a long-term impact on child's health and educational outcomes.
Yeah, I was saying to you before we started the recording, Gergo, that my work is in with early career teachers, and I can imagine that there's, those teachers listening to this podcast, you might also be thinking, if they've got a young person, a child in their class who's perhaps absent, or there's a kind of pattern of absence, it might well be down to the place that they live. And it might not be the family, it might be a very supportive family, of course, but it could simply be the conditions that they're living in, not simply, but connected to the conditions that they live in. And it's just helpful to know that, isn't it, if you are
Absolutely.
a teacher working in schools, and to be aware of that possibility.
Yes, absolutely. We really find that the association between having mold and home was particularly strong with authorized school absences, which is related to medical appointments, related to just being sick and staying at home. So we know that in this case, the association was particularly strong with this kind of absence in school.
Yeah. So it sounds like there's lots of questions that still haven't been answered by the end of the work you've done so far. What's the next thing for you? What are you working on now? What would you hope to work on next?
So in long term, I'm very interested to find out whether, as I mentioned, whether there are sensitive periods during our development when exposure to different environmental characteristics might have a very long-term effect on our health and well-being. So I will also continue this research in the next few years, hopefully, and focusing on different health outcomes, not just on neurodevelopmental disorders, but also on other mental health outcomes and so on, and potentially using not just the Millennium Cohort study, but other studies we are hosting in our center. Because we have also studies where the participants are right now in older age. So it would be very interesting to see whether if they were exposed to specific environmental characteristics in their young age, has still an impact on their health, like 50 years later. I'm asking these specific questions because back in Scotland, we were very fortunate to use a few data sets where the people were born in 1936. And we were able to link, for example, air pollution during the first few years to the addresses where these people were living. And we find that people were dying a few years earlier if they were born in an area with higher air pollution level. So we see that there might be an extremely long-term association between air pollution exposure and longevity and health in late adulthood.
Well, it's clear that you're a real advocate for longitudinal study, for cohort studies in general, and I can well see why. Thanks, Gergo, for coming in, for speaking to us today. It's been really fascinating, actually, to listen to. It's been lovely meeting you and talking to you. And I've been particularly interested, actually, in all the implications that this has for social policy, for people actually working in the front line in schools or in housing or as landlords and that kind of work. I think there's strong messages for them in what you say and in your research. So thank you for that. And thanks for doing the podcast.
Thank you very much for the opportunity being here.
You've just heard from Dr. Gergo Baranyi. Some of what we've covered today is also available in the episode notes. If you've enjoyed this episode, we have an archive of 25 past seasons. Just search IOE Insights to find episodes of Research for the Real World, as well as more podcasts from IOE. Regular listeners of the IOE Insights podcast might also be thinking, hang on, this voice sounds familiar. Well, you're right. I also present The Staff Room with my colleague Elaine Long, where we chat with educational professionals at all levels about the realities of school life, supporting us all to make meaningful connections between research and practice. I highly recommend listening to that, but take a biscuit and a favourite drink with you as well. And a quick favour before you go, if you're listening on Apple or Spotify, we'd really appreciate it if you could give the IOE Insights a rating. 5 stars would be nice if you're enjoying the show, and that will help us to reach more people who are interested in hearing about such important work. I'm Mark. Thanks for listening.
Research for the Real World is brought to you by IOE, Research Development and IOE Marketing and Communications at University College London. The series producer is Amy Leibowitz. The executive producer of the IOE Insights podcast is Jason Elagan.
Thanks for listening. Search IOE Insights for more podcasts from the IOE.